Hello, and welcome to Leadership PRN. This is the Dalhousie Faculty of Medicine podcast for leaders both new and emerging. My name is Dr. Lara Hazelton. I'm a psychiatrist with an interest in leadership and medical education. Today, I'm very pleased to have someone on the podcast who I've known for a long time, since he was a psychiatry resident on one of the services where I was a staff person, Dr. Scott Milligan. Hi, Scott.
Hi, Laura.
I really appreciate you joining me today. As I said, we've known each other for a long time. Our family, they were friends, and I've watched your kids grow up and so on. And I was really glad when you agreed to come on the podcast, because I think you have some insights from your career that would be really useful for leaders to try to look at how they can make medical education and training and then even practice more accessible. So thank you for coming here. And I know we're going to hear some stories about some of the really exciting things you've been doing recently as well.
Yeah, thank you for having me.
So, Scott, tell us about yourself and your career in medicine to date.
So, I did medical school in Alberta. So, when I was 21, I was on a summer job and I fell off a roof and I fractured C1, C7, C6, and C5 vertebrae. So, fortunately, my spinal cord injury level is more at C8, T1. So, I have most of the function in my hands and arms. So I started medical school maybe 3 years after my injury, or 4 years. And I was the first medical student at the University of Alberta in a wheelchair. So it was interesting thinking about this podcast and looking back on my training and my career. I shudder actually to think, how did I ever do this? You know, you're interested in accommodations and barriers and so on. And I have to, forgive the faculty because I was the first one through their program.
And Scott, can I just ask what year that was that you would have been starting medical school in Alberta?
1994.
Right.
So there really, in terms of accommodations, there really were none, to be perfectly honest. And in retrospect, I wish I'd gone to the University of Calgary, because at least it would have made the anatomy lab easier, because in Calgary they had prosected specimens. So when I started med school, I purchased a chair, like a stand-up wheelchair, which sort of allowed me to be at the standing level at, the anatomy lab or during my surgery rotations, things like that. So it was more me finding ways to accommodate the situation than the other way around, to be perfectly honest. So yeah, that was the level of accommodation, really. And I basically went through the same way anyone else would.
Were you expecting, before you went to medical school, were you anticipating, I should say, maybe how difficult some of these challenges were going to be?
Not really. I mean, I would, in some ways, newly injured, but at the time I was young. I had a lot of strength and sort of was able to push through a number of things. But you never really know what it's going to be like. And at the time as well, I was on a medication called baclofen, which made my blood pressure extremely low. So that was another struggle. I remember a anesthesia rotation, and they just couldn't get a radial pulse, so they laid me out. We're about to start an IV, just because my pressure was so chronically low, which is another story, just in terms of how the sort of difficulties I had in getting good medical care. But
And when you started medical school, were you already thinking at that point, and I mentioned at the beginning that you're a psychiatrist and you're practicing right now in Cape Breton. And were you thinking at the time when you started medical school that you were interested in psychiatry, or were you still trying to decide what your field of practice might be?
Yeah, psychiatry was never on my radar until second year medical school. And then I thought, yeah, this I like. And in terms of physical limitations, it's definitely one of the better specialties in that regard.
I have to say, Scott, one of the things that I know about you is you're actually one of the most resilient people I've ever known. Because I can imagine a lot of people, it'd be very daunting. You get to medical school, there's the anatomy lab and the tables. They can't even arrange for the tables to be a height that works for you. I think a lot of people maybe at that point would have just said, this is just too much. I'm going to look at some other career. Did you ever feel that way, or?
In many ways, I did. I mean, and like I said, when I was looking back on this, I thought, how did I ever get through this? And part of it is, it's just one day follows another. And as you know, in your medical training, you go through rotation. It's, 4 weeks or 8 weeks, and you just look forward to that next hurdle. So that's really how I got through it. Believe it or not, I've never been one to really complain about these issues.
Oh, I believe that. Yeah, I believe that. Yeah.
Yeah, but so it's odd for me to even be on this podcast talking about it because I've never really to advocate for myself in this way. But I think it is important, actually. The older I get, the more I see the importance of this for others and myself.
Yeah. And this is honestly why I'm so glad that you did agree to do the podcast, because I've known you for a long time, but we haven't never really, talked about it much. And I know you haven't, when you were training as a resident, you were doing all the same things, the call, and so on. And I think like I said, there's a lot of people who, could contribute with some adjustments, some accommodations that would make it possible for them to do it. People who, maybe aren't as resilient as you, but would be great doctors. And I think that medicine is becoming more aware of that now than it used to be. But there's still a long way to go.
For sure, there's a long way to go. And I'll give you some examples. Just in my medical school, I was there for 4 years, usually sitting in the front row because it's, the theaters are not accessible. And at the graduation, the dean of the undergraduate education there, of course, says, like they always do, would all the graduates please stand up? And you just go, like, was I invisible for 4 years? So just little things like that, that make you wonder.
Well, and you and I have talked about conferences and other settings we've been to that aren't accessible, right? Like there's not room for your wheelchair in a room, or that comment about standing up, or carpeted areas. And I mean, those are just the things that I've noticed when I'm with you. I mean, obviously I don't see all the things that you've encountered throughout your life on a regular basis.
Yeah, there's little details like that. When you and I last met was at a conference in Halifax, and we sat literally right by the exit because there was no way to get around the tables. There's chairs everywhere. It's hard enough even standing up and trying to squeeze between the tables. It's just impossible in a wheelchair.
And when you went to your clinical rotations, so you had your anatomy lab and your first and second year experiences, and then when you went into the clinical settings, did you have some support? Did you have some recognition of the barriers that you might be facing that the medical school could help you with?
No, not at all. I'll tell you a story in my first year residency. Well, in my third year clinical rotations in medical school, I, of course, had long hours, so I get dependent edema. So that caused me to get a pressure sore during I think it's my internal medicine rotation. Then the preceptor I was working for put me on clindamycin, which of course led to C. difficile. So I had a very unpleasant experience in a call room subsequent to that. But I still worked, still did the rotation. In my first year residency, I again had a pressure sore issue that was ongoing for a few years, and I finally had surgery for it. So I was off for 2 weeks during my internal medicine rotation, but they took the call days that I was scheduled to do during those 2 weeks I was off and put them on when I returned, and then then Lara, get this, then they hid the schedule so I wouldn't notice it. I'm going like, why have I got like call every 2 or 3 days when that was the level of accommodation?
Yeah. Yeah. It's hard to hear some of the stuff, honestly. And this would have been when, like the early 2000s? Is this when
This would be 99.
1999, yeah. I know that when up in Cape Breton, you're involved with teaching, or you have been involved in the past, at least, with teaching medical students and residents. Do you have any thoughts about how medical education has changed, or maybe not, since you went through?
On the topic of accommodations, it does seem that there is much more awareness, and even seeing the changes in call requirements for residents. If you're in-house call, I don't know what the rules are. You'd be more familiar with them than me, but if you're in-house call, you go home at 9 o'clock the next morning, or there's a lot more stringent rotations in terms of protecting the kind of health and well-being of residents than when you and I went through. So I think there's perhaps more awareness, but there's still challenges. I'll give you an example. At the hospital I worked at for 20 years, I was part of a committee that looked at accessibility just getting into the building, because all the entrances were really not they're theoretically accessible, but they all have a slope, and sometimes a significant slope, to get into the building. And the older I get, the harder it is to do that. Like now, I really don't go anywhere without somebody pushing me. So they had to actually make a new entrance, a 0 grade entrance at one of the between two sections of the building, to make it easier for people in wheelchairs. The trouble is, general Joe public that's using a wheelchair coming to visit the hospital can't access that entrance because it's a keyed entrance. So even infrastructure is poor, even in this day and age.
Isn't that ironic that a hospital would not be accessible?
It is, yeah. It's hard to imagine. But again, unless you have people with lived experience giving advice, what people think is accessible is not actually accessible.
Well, it's interesting, actually, because I was thinking about, the importance of lived experience, which, again, is why I'm so glad that you've, agreed to come on the podcast. And it kind of works both ways, because on the one hand, you see, people might think something is accessible and it's not, but also people might think that something couldn't be done by somebody who uses a wheelchair, for example, and yet it's something that you can do and have done. So that perspective of like, yeah, these are things that I can do that people might not think you've been able to. I bet that's come up a lot for you as well.
It has, probably less than the barriers, I think. But it's also, I'm aware of the privileges I have, though, and even where my injury is. If my injury was at the C5 level, it'd be a completely different life that I'd be living, without use of hands and being able to transfer myself and so on. When I was a medical student, there was a radiologist in Alberta who was a high quad, who broke his neck, I think, in his medical school, sometime during medical school training. Connor McGuire, his brother's a psychiatrist in Nova Scotia. And when I think about what he had to go through as a high quad, it just makes me shudder, because there's a world of difference between, what I had to go through and what he has to go through. So perhaps that helped me get through it, in the sense that just people have it harder, and I'm in many ways very lucky and blessed with, despite all these appearances, a pretty well working body. So,
and I know you've had the support of your family as well.
Exactly.
So when you think about like some of the things that people don't know because they don't have the lived experience, or they don't have the discussions with people with lived experience, what are some of the things that you think people should, or you'd like them to know about trying to be more inclusive, trying to make things more accessible for their colleagues, for the learners?
I guess it would be just talk to the person that's got lived experience. I mean, you and I met several times at the Royal College exams in Ottawa. I'm not sure how many years I did that, but maybe 5 years, somewhere thereabouts. And in the end, I stopped doing it because it was just so physically difficult. And there was sort of so little recognition from the folks that were there. For example, it's the same issue with closed spaces, chairs between tables, and uh, you'd have to break up in groups to discuss a case. And at one point, I had to get a hold of the moderator to say, "Look, can you have the group come over to me because it's physically impossible for me to get over to the other side of the room where that was." And it's the same with any conferences I've been to. They're all in hotels with miles of carpet, which is extremely difficult to push through. And then getting into the building or into the main room itself with all the tables, it's very challenging.
Do you have any advice for people? Like, I'm just thinking for, let's say, the Royal College, or the organizers of some of these things. Like, do you have any advice for them on how to ask you what would be helpful? Because I think these are conversations that people often don't have, and so they might even not know how to broach the subject, right? Like, do you have any suggestions of what people could say to ask you questions in a way that wouldn't feel, offensive or demeaning or too personal or intrusive?
Yeah. Yes. No, I understand people are afraid to ask those questions, but as psychiatrists, we have to ask people difficult questions all the time. So I think you can do it. You can do it.
It's true.
Just ask, right?
Yeah. That's a good point, actually. But not everybody's a psychiatrist, also, right? So.
Oh, for sure. Yeah.
Yeah. It's interesting. I think, we've been doing a lot of work, at least in, at Dal, among the faculty, and trying to teach people how to have conversations around race. And I think having conversations around, accessibility is the next step in some ways. I don't know that we've necessarily been developing those skills as much as we might.
It's like, I understand Halifax is an old city. A lot of the houses are old, they all have stairs and so on. Same in Cape Breton. But there's been a few places where I've traveled where it's like there's a different mindset. The best country I've ever been in terms of accessibility and deliberate intentionality to make places accessible was Japan.
Oh, okay. Really? Interesting.
Yes, it was miles ahead of anywhere else. For example, you go through the gates to take a subway train. They'll stop me, ask where I'm going. They'll come with their white gloves and a little ramp. They'll stop the people to allow me to get onto the train with this ramp, which I actually didn't need because the platform was designed so well that it's only about a 2-inch rise between the platform and the train. They'd help me get on the train, and there'd be somebody waiting for me with the white gloves and ramp at my destination.
Wow.
It was unbelievable. Swimming pools. It's the only place where they've had swimming pools that have a bench where someone with a disability can actually get changed and get dressed again. I've never been anywhere else. Well, actually, Iceland had what was probably a close second, but Japan was far and away the best. I'm not sure why that was the case. In 2013, 2014, my family had sold our house, and we did a sort of overseas mission trip for 6 months. And we spent a month in China and then 2 months in Japan. So going from China, where there was sort of, in a sense, lip service to accessibility concerns, they would have ramps in various places, usually completely covered with bicycles, so you couldn't use them. And then you go to Japan, where you go to the first washroom in the airport, and it's state of the art, completely accessible. So I'm not sure why, but there was clearly a deliberate emphasis on the part of the Japanese government to make the city accessible.
That's really interesting. It's got me curious. I'll have to look and see what their medical education, if they've tried the same sort of thing with medical education. Might be a cultural thing. Yeah, that's interesting. And it brings, one of the things I know is that you have traveled a lot, like a lot more than me, for sure. And I know recently you were in Ukraine, and I mean, I am curious about that experience as well.
Mm-hmm. So in last May, 2 months ago, I went with my son back to Kiev, but we went there a year previously as well. So it was an interesting experience both times. The first time I had to make travel arrangements myself, and here's a little travel tip for folks. Even though I'm contacting the train company directly and saying, look, I'm in a wheelchair, I need a wheelchair accessible compartment on the train and so on. When I tried to do that myself, it didn't work out. I got train tickets, but they were not accessible, and it was extremely challenging. The second time, this last May, when I went, I was invited by this organization called the Pinchuk Foundation to give a talk on PTSD. So the folks in Kiev organized my train travel from Krakow to Kiev. It was a different experience. I had an accessible train from Krakow to the border of Poland, and then an accessible train car from there to into Kiev. And when I arrived at the Kiev train station, I was met by some folks there, and they had a nice accessible van for me. They took me to a hotel they'd arranged, which was all accessible. And they clearly were thinking about it, not just for me, but they kept asking my opinion. Like, I visited a few clinics there, and that was their question: how is the accessibility?
Mm-hmm.
I was impressed.
Yeah.
Just a trivial example. When I gave my lecture, they had a platform in the front, and they had a ramp on the one end that was actually a usable ramp. And when I went up to speak, they removed the podium that people would stand at, put a small table there with a microphone and a glass of water for me. That's never happened to me before. Just that level of thought to accommodate me. I've never experienced that before.
It's so interesting. Like, again, just thinking about all the ways that accommodations can make full participation for someone so much, easier. And then, I mean, obviously, I think you have so much that you do and have contributed in your career, right? I mean, not just speaking, being a Royal College examiner, teaching, but, the years that you've dedicated to the people in Cape Breton, right? And to the mental health system in Cape Breton. And, it does make me feel kind of sad to think of the lack of attention maybe that's been paid to everybody kind of doing their side of things so that you could do the side of things that you've been doing for so long.
Well, it was just an interesting experience, both being in Japan and then this last trip to Kiev. And in Ukraine, it's because they've got now thousands of amputees or other injuries, so they're much more acutely aware of what the needs will be for their society. But yeah, it's moving that they recognize that and took those extra efforts. And even something as simple, Lara, as when someone's talking to me, if they sit down or sort of crouch down to be at my level, it's almost shocking to me when someone does that. But it makes a big difference.
Well, that's an example of something that, our listeners could do, right? That I don't know that I always do that, right? So that's some good advice that is actionable, right? That could put into play.
Yeah. Well, I remember being at some sort of conference over at the Lord Nelson Hotel there in Halifax, and your colleague, Kimberly Cassidy, she did that. And it was so shocking to me that it stuck in my mind. Because, people don't really think about that. And I don't think about that. Like, I'm not sort of looking for that. But when she did that, it meant a lot.
It meant a lot.
Yeah, meant a lot.
So, so I really do appreciate, you coming on here today, like I said. Are there any final thoughts that you would have that you would want to share with our listeners about how they can support people that they work with who may have accessibility challenges?
So my first piece of advice would be, don't be afraid to talk to them about it, and don't assume that you know what works and what doesn't work. It's easy to think that you know about accessibility or that you're accommodating, but unless you talk to the person, you won't really know. In some of my travels, there's countries where, like Germany, my wife's family's from Germany, so I think I'm entitled to say this. They think they're accessible, but the reality is not so much. So always be open to listening to the person. And I can't speak for everybody, obviously, but I'm never offended when somebody asks me about that. And usually it's the more disinhibited patients that will be quick to ask about it. What happened to you, or things like that. There's actually a veteran that I'm seeing now who I saw back in 2014. First time I saw him for an initial assessment, he didn't come back because he thought, this guy's got more problems than me. So it wasn't until 10 years later that his wife got him back in to see me. So you get all kinds of different responses, but don't be afraid to ask people what would be helpful. The other thing I'd say is think long term. At the moment, we have the remedy happening, so all people that in institutions are being moved into the community, which is a great concept. The trouble is, there's an extreme poverty of accessible housing out there. So when people build, having a barrier-free house is not a barrier for people that don't need the accessibility.
Right.
It works for everybody.
Yeah.
So think it in those terms rather than just accommodation. Just think planning for barrier-free access, so you don't have to worry about it for anybody. That's my thoughts.
Scott, thank you again so much, and it's been really interesting, and I think it'll be really some helpful insights to share as well.
Thank you for asking me. It's been my pleasure.
And that's another episode of Leadership PRN. If you have a topic you'd like to hear me cover or someone you think I should speak to, you can reach out to me at lara.hazelton@dal.ca or lara.hazelton@nshealth.ca. Until next time, take care.